My name is Oluwakemi Bidi. This is my DNP project. The title is Pain Assessment and Management, Nurses' Role in Improving Patient Experience and Outcomes. These are my committee members. My chair is Dr. Geraldine Francine. Just a little background about pain. So pain is a global problem. It is one of the reasons why patients present to most acute care settings and one of the reasons why they seek help. So when patients have pain, pre-existing conditions can actually become worse with acute pain. And pain actually poses an economic burden on the healthcare sector. So in the United States, a lot of people are actually living with pain. They are dealing with pain on a daily basis. So it is necessary that nurses have the right pain assessment to help them choose the proper pain management interventions for their patients. So pain of any type is costly, whether acute pain or chronic pain. Pain is costly. But before we dive even further in this presentation, it is necessary that we define pain. Pain is whatever the patient or the person experiencing it says it is, and it does exist whenever the person experiencing it says it does. Pain, there are different kinds of pain, but our focus is on acute or chronic pain. The difference between acute and chronic pain is based on the onset or the time that the pain started, the signal that the body is receiving or putting out, the severity of the pain, and if there's any central nervous system involvement, and the effect the pain is having on the body, that psychological effect that the pain is having on the body. So acute pain acutes for almost 85% of patients who present in any healthcare setting. And research also shows that more than 20% of adults Americans live with chronic pain. So engaging hospitalized patients in timely and effective pain management actually promotes a better quality of life for these people and early hospital discharges. So when it comes to pain assessment, there are different pain assessment tools, and it should be patient specific because patients are different. The setting where nurses will perform, take care of patients will be different, and the conditions of the patients are also different. Cognitive status will also be different, but the necessary thing is for the nurse to be able to interpret whichever tool they use in pain assessment. Project significance to nursing, healthcare, and advanced practice nurses. As nurses, we have a moral and ethical obligation to perform the right thing for our patients. So one of the right things that we can do for our patients is to assess them and provide the necessary pain management as ordered for the patient. Pain management must start as soon as the patient walks into the hospital, so as not to delay treatment. So empathy plays a key in pain management because when empathy is involved, nurses do the right thing. They attend to the patient in a timely manner, which promotes better patient outcomes and increases patient satisfaction. In terms of healthcare, pain is a public health issue, and policies that address patient safety is vital, especially in this period of opioid crisis. So as much as possible, we want to manage patients' pain, but we also want to keep our patients safe. So when it comes to healthcare, inadequate pain management also can lead to other medical issues such as anxiety and depression for the patient, which can also lead to a revolving door for the patient between hospital and home. And this in turn eats into the healthcare resources. When it comes to advanced practice nurses, we as advanced practice nurses, we use the knowledge gained to make changes, be involved in policy making, become better leaders, use knowledge gained to make changes that is backed by evidence. So we, under the educational exposures that we are currently having or that we are having, we can use this to actually promote better health quality for our patients as we help other nurses to become involved in early assessment and early administration of appropriate pain management therapies. This reduces patients' frustration and increases patient satisfaction. This project's purpose was to determine if nurses were performing pain assessment and reassessment on patients admitted to a local medical surgical teleortho trauma unit per the hospital's policy and procedure. The aim of the project was to educate nurses on barriers that were identified during this project implementation, and the education was to address these issues so nurses can become more comfortable, more aware of these barriers, such as attitude about pain and cultural differences about pain, inadequate education about pain management, so they can be able to provide better care to their patients when it comes to pain management. This in turn promotes better patient outcomes, which increases patient satisfaction. For the literature review, 4 things were identified, including pain assessment and management, communication and nurse-patient relationship, pharmacologics and non-pharmacologics, and pain management tools and strategies. When it comes to pain assessment is key. You have to have pain assessment on every patient so as to have a baseline with that patient when it comes to pain management. Communication is key between nurse and patient to set up a care plan about pain. What is the goal for that patient when it comes to pain management? Because with some patients, pain will never be a zero. So you want to come up with realistic goals with your patient. So communication comes in. Pharmacologics and non-pharmacologics, they are of great benefits when it comes to pain management, because this is how we manage pain in the acute care setting. So it is necessary that nurses be aware of this pharmacologics and non-pharmacologics, including their benefits and the risk that are involved in using some of them. So when it comes to pain management tools and the strategies for using them, pain management tools should be brief, should be easy to use, and the strategies would depend on the patient that the nurse is taking care of, and depending on the setting that the nurse works. The theoretical framework that was used for this project was based off of Kolkaba's comfort theory. So comfort provision is what we do as nurses. So when it comes to pain management, the ability to be able to provide comfort actually helps improve the overall health of the patient, thereby restoring health-seeking behaviors for that patient. The patient is able to better participate in their own care and be as independent as possible. For this process change, nurses had to perform initial pain assessment on all patients. Nurses had to communicate and determine the appropriate pain assessment tool for their patient. And patient also had to state tolerable pain rates or pain goals. And nurses had to assess and reassess after any pain management interventions. And nurses had to use to assess patients during hourly rounding. And they also had to advocate for their patient if the pain management intervention was not effective. These are all the conditions warranting pain assessment. It is the fifth vital signs. It must be done every 4 hours and as needed, including admissions, during roundings, pre-post medications, and as during any procedure or even before a procedure. A quantitative methodology was used to evaluate pain assessment and reassessment. A chart review was done retrospectively. 50 charts were done, which were reviewed pre and post education. A data collection sheet was created, and this project was done on a unit called the Medical Surgical Teleorthopedics and Trauma Unit, which we refer to as the MSTOT. And all of this happened after gaining the IRB approval from the hospital and the Maryville University. For the result analysis, the Mann-Whitney test was used, and the Z test was also used to answer the parameters that were being investigated in this project. A convenience sample involving 50 adults pre and post. There were 25 males, 25 females in each group, and the other criteria as listed in here. But one thing that was very important for this project was for the patient to be able to use the numeric pain scale to rate their pain. Both descriptive and non-parametric statistics were used for data analysis. The Mann-Whitney U test was used to analyze results between two independent groups to see if there was any difference in the values between these two groups. 5 variables were considered, and they included if opioids were used, non-opioids, and pharmacologics, including if reassessment was done in 30 minutes and 1 hour. In the following slides, we'll be discussing the results. This is an overall comparison of all the 5 variables, and from this tabular representation, one can see that there was an overall improvement in all the variables after education was given to the nurses, except for the opioids. There was no statistical change at all. This table indicated that the education was actually effective for the nurses. In this slide, there was a comparison of pain levels between the pre and post-education samples. And from this slide, we could tell that the pain levels increased in the post-education, which showed that nurses were actually doing more pain assessment, which led to patients reporting more pain. In this slide, pain management was effective as nurses used non-opioids after receiving education in the post-education sample, and this shows that nurses became aware of the importance of using non-opioids versus just opioids for pain management. Non-pharmacologics also increased as the number went from 36 to 39, and there was a statistical difference in that. So the outcome was positive. When it comes to reassessment, 30 minutes in the pre, it was low. After the education, we can see how the number jumped from 7 to 21 after education. So there was a significant improvement in reassessment after 30 minutes of intervention. 1 hour after intervention, again, there was a significant change after the nurses received education, as the number of patients that were reassessed after education rose to 40 as compared to 22. So there was a significant change in the results obtained. In the opioid groups, after receiving education, although there was a slight rise in opioid use, the statistical interpretation was not significant after data analysis. So there was just 36 patients in the pre-education, and the number rose to 39 at post-education. So the number rose, but the result was not significant. This chart is just a graphical representation of all the variables that were analyzed in this project. This chart is just showing the pre and post-education samples, and you can tell the results did show significant differences in improvement in after education in the post samples, except for the opioids again. This project did experience some limitations, including it being conducted in a single hospital, although this hospital belonged to a bigger umbrella. It's part of one of the biggest hospitals in this area where the project was conducted. The sample size was small compared to other pain projects, and the length of study was also short compared to other pain projects from the literature review, and the unit nurses' attitudes towards change was another problem encountered. In spite of all the advances in healthcare and science, pain control still remains a big problem in healthcare. So nurses do play a big role in pain management by how we assess and then manage our patients when it comes to pain. It is necessary that we use both opioids and non-opioids for pain management, and pain assessment and reassessment is vital before and after to set a baseline and to determine treatment effectiveness. This quality improvement project has shown a lot of benefits in how nurses can actually improve patients' quality of life by using a multidisciplinary approach for pain management, by improving themselves educationally using evidence-based practice guidelines to help patients manage their pain, and also making sure pain management is done without compromising patient safety. And doing that will then ensure that patients live their lives as well as possible while promoting independence. Finally, pain continues to be a problem despite all the advancements in science and technology. And this is because pain and its management are complex. So more research is needed on how to improve pain amongst patients, especially in the acute care settings. Barriers addressed in this project can be improved upon using education. Nurses can improve patients' pain experience using evidence-based pain management guidelines, which promotes quality care, patient safety, and reduce hospitalizations. So I have come to the end of this presentation. I don't know if anyone has questions are welcome. These are my references.